metric tons by 2030, demanding investments between 10 and 15 billion United States dollars. Despite financial and technical hurdles, we're determined to meet the Paris Agreement's goals across agriculture, transport, forestry, energy, and other sectors. We have made strides. The Green Ghana project has planted 50 million trees, and forest restoration efforts have covered 721,000 hectares since 2017 when I came to office. 13 mitigation actions have cut annual greenhouse gas emissions by 43% since 2021. Ghana's national electric vehicle policy, backed by tax incentives, promotes sustainable mobility, and our energy transition framework steers us to present.
However, from that, Lordina Mahama, accompanied by the former president John Dramani Mahama, has inaugurated a newly built maternity and children's ward in Bodom, in Kranza North District in the Bono region. Now, this much anticipated facility comes in response to requests from local traditional leaders who emphasize the need for improved healthcare access for mothers and children in the area. Speaking at the ceremony, Mrs. Mahama highlighted her ongoing commitment to maternal health care, expressing confidence that the facility will contribute significantly to safer deliveries and healthcare pregnancies.
This is the third facility the Lordina Foundation has built in 3 years to improve access to maternal and child health care. This modern maternity and children's facility will bring dignity to every mother, child, and family in this community.
The Foundation has positively impacted maternal and child health in countless ways, from building and renovating maternity wards to supplying medical equipment to facilities in mostly underserved areas. Today's inauguration in Bodom continues this proud legacy and adds a new chapter to the organization's mission of service to Ghana. This new maternity block we inaugurate today has facilities that will significantly enhance the Bodom Chips compound, its ability to provide essential maternal and neonatal.
This is the third.
On some health issues, the Member of Parliament for the Dadekotopon constituency, Rita Na Odole Soam, has stated that the next NDC government will ensure the completion and operationalization of the stalled reconstruction of the La General Hospital. Her assurance comes amidst the increased frustration of residents over the prolonged delay in the reconstruction of the La General Hospital. Residents lamented their businesses have suffered due to the closure of the hospital. But a few days before the election, the residents have lost hope in the government's ability to rebuild the hospital. Rita Odole Soa has, however, promised to ensure the completion of the project should there be a change of government. My colleague Andy Opondentry has more in this report.
Government could have done way better, because as Member of Parliament, I cannot just walk into their meeting if I'm not invited, and they do not care about it. I raised the question on the floor of Parliament for the trade fair, and I was given the response that the trade fair belonged to a private entity, and the government has a board in there. The government appointed, the MPP government appointed the chief executive. So how could this be, a private entity? So I do not buy into that. And then, like you said, the people have come out to demonstrate and all.
In the heart of Accra,
yes, it is our right to know what's going on there. And if we are not being given any form of information, we'll go out there to demonstrate. So
in the heart of Accra, Dadekotopon constituency sits an empty lot, the former site of La General Hospital. Once a vital healthcare provider to thousands, in 2020, the hospital was demolished due to severe structural concerns, with President Akufo-Addo initiating a reconstruction project on August 10, 2020. Yet, 4 years on, the site remains uncompleted and the community is left without a central hospital. Funding and staff shortages have delayed the rebuild, leaving both residents and healthcare workers in a state of limbo. Despite these challenges, the community is holding on to hope that the hospital will soon be restored, bringing healthcare access back within reach. But as the wait prolongs, the Member of Parliament for La Dadikotopon, Rachel Dole-Sowa, says should the NDC win the election 2024, they will see to the completion and operationalization of the hospital.
Yes, there's going to be a change of government. The good people of Ghana are tired of the MPP administration. They have lied to us severally, and the people of Ghana are going to vote for His Excellency John Dramani Mahama, and the people of Dadikotopon will vote for Retano Dole-Sowa. And His Excellency John Dramani Mahama, who has done it before, he knows the need for healthcare facilities. He has promised the good people of Dadikotopon, when he comes into power, it will be one of his prioritized projects to ensure that the hospital for the good people of Dadikotopon, which is the La General Hospital, will be completed in good time.
She added that the government has shown less commitment to completing the project, bemoaning that the delay in completing the hospital has led to an increase in mortality within the constituency.
A lot of people have lost their lives because of the demolition of this the hospital for the good people of Dadikotopon and Ghana, because that hospital served a lot of people coming from far and near. And so we have lost lives, and we have a polyclinic. The polyclinic used to work and close at 8 p.m. I went in there, I spoke with the administrator and the team, and I have supported them with some funds from my health fund, and now we have a maternity block.
Residents say the delay in completion of the hospital has not only affected their access to healthcare, but has also taken a toll on their businesses, as hospital staff and visitors who used to purchase their product are no longer available.
The MP has made provision for the Latenu to be made into a polyclinic. We are hoping that the hospital will be completed to service those from far places. This place used to be a busy place with both family members of patients and health workers eating. We are hoping that the government will complete the project. Moreover, the workers are not available to work. The stalled project is highly affecting residents of this constituency. We are looking forward to its completion so that everything will return to normalcy. People will end up losing their lives due to traveling long distances for health care.
Meanwhile, the Ministry of Health's Public Relations Officer, Isaac Ofe, has disclosed that the La General Hospital project is expected to be completed in the third quarter of next year, adding that the project is an issue of contention for everyone. The hospital is not only for the people of La, he said.
So the La General Hospital project, we all know, came down as a result of the defect in the building, the structure. So government committed into ensuring that we put it up again in a more standard manner. Over the years, there have been a lot of challenges with the contractual agreements, which government results into forming a new contract base. The timelines should be at least by the third quarter of next year. That project should be done. But you know, it has a lot of package in there. The residential bungalows for nurses and doctors, the other facilities that are added to the clinic itself, the hospital itself, and the attachment thereof. And so, even if people can go to the OPD today and access primary health care and all that, we cannot say that we have finished. We want to see the bungalows for the the residents, professionals who will be coming in there, the doctors, the nurses, and all those things attached to it. So even if the clinical aspect is finished, we cannot say that it's finished until we have our medical doctors, you know, that their residents put up. So we give ourselves the third quarter.
Away from health, we are back with some election news, and we still remain your election poll center. your election poll center, we advocate for vote and not violence. As you go to the polls, make sure you only cast your vote and not indulge in violence. Let's now stick with some the flag bearer of the National Democratic Congress, John Dramani Mahama, has stated that a vote for the NPP's flag bearer, Dr. Mahmoud Bawumia, in the upcoming election is an endorsement of 8 years of hardship and bad leadership under the Kufuor Bawumia government. Addressing supporters at a mini rally yesterday, the NDC flag bearer bemoaned the hardship Ghanaians have endured under the current administration. He called on all well-meaning Ghanaians to vote out the NPP government for their mishandling of the economy and bring in the NDC to restore the country's economy.
Emenaso, Obia, Obetuaba, Ama Bawumia, and no say, and fear what tree, say, I must say, Yesika Sem, a car, Mama Bedaya so. A hochra ya achi Ghana for a just we need you. Obia obeto ama Bawumia and say near esi ife watri say a hochra achi say a car bed die so say Yesika Sem as say a just a yadia ofuaso. Enti say one fuaso and yet was all yen say I was system. Na omokot nefi. Osono enye ne dabre eni krom osono ne dabre ye kwaye mu ezu nipa dabre ni krom enye osono enti emre na so se ohena osono a efi kwaye mu ebaye efie wotwe ni asai Ghana for ade nyina Samre na so say ye pam osono no osako baby ofi bae Oko.
And still with the NDC, the flag bearer of the National Democratic Congress, John Dramani Mahama, has emphasized the urgent need for reforms in Ghana's healthcare sector, citing rising costs and inadequate infrastructure as critical issues. Speaking at the commissioning of a newly constructed maternity and children's ward in Bodom, in Kranza North on Tuesday, November 12th, Mr. Mahama reaffirmed his commitment to implementing free primary health care for all Ghanaians. He stressed that accessible and affordable health care should be a priority, particularly for underserved communities.
Because they cannot afford to have hygienic pads to be able to protect themselves. And so this is another program that we will introduce for schoolgirls. This initiative will directly impact the health and attendance of young girls and ensure that they can continue their education. I want to reassure you that our commitment to inclusive healthcare will extend beyond policies to practical on-the-ground support like the ones we are seeing today. You can bear witness to the investments we made in healthcare when I was president. So you know these are not just promises, but part of a comprehensive plan to improve the health, well-being and dignity of every Ghanaian.
And still on election-related matters, presidential candidate of the New Patriotic Party, Dr. Mahmoud Bawumia, has stated that the NPP government has outperformed the National Democratic Congress across all sectors, despite facing global challenges like COVID-19 and the Russia-Ukraine war. Speaking at a community engagement in Akronfrum, in the Ashanti region on Tuesday, November 12, Dr. Bawumia stated the NPP, notwithstanding COVID-19 and all global crises, every sector of the economy have performed and have done better than the NDC.
That is the central line. Eko from Accra to Paga. Yedi from Kumasi to Eko Takradi. Then we are taking it from Ejisu to Eduarding. And then we are taking it from Awaso through Ninahene to Eduarding. Sa rail noa yedi bano. Edi Ejuma Bebre Ebebre Yememuno. Ejuma Bebre na yedi ba. We are going to use local materials. The railway is transformational. Yebe chenji niema Bebre.
A Away from that, let's head straight to the Electoral Commission, where it's set to transport ballot papers for December 7, 2024 election to the various regions from November 14, 2024. This is contained in a letter addressed to the General Secretaries of all political parties dated November 13 and signed by the Deputy Chairman in charge of operations, Samuel Tete. Quoting, I bring you warm greetings from the Electoral Commission and trust that this letter finds you well. This inform you that the transportation of ballot papers to the various regions will start tomorrow, Thursday, 14th November 2024. Quote, Mr. Tete wrote, the transportation of ballot papers to the various regions marks a key milestone in preparation towards a forthcoming election. This critical election document will be kept in police custody and released on election day to elections officials under the watch of the party agents. Away from that, the founder and leader of the Movement for Change, Alan Kojo Tremontin, has promised to drive economic growth for the country's cocoa farmers by focusing on reform and greater financial independence. He promised to end a syndicated loan scheme, which he argues has burdened the industry by creating dependence on external financing. Speaking to a gathering of chiefs and local communities in the Ahafo region as part of his caravan campaign tour, Allen condemned the current and previous administrations for what he describes as exploring cocoa farmers of their rightful income.
One said, Omega Damo, whether almost say, oh, I took a call, whether no say, not to tell you, if you say, solution world market price of cocoa, say, every $7,960. Almost $8,000. Never check the mamma. So say, you want the mamma, one more, extra minister, no more would be at the same. So, this is simple power. This is simple. The top of Corona, you're not feeling. Yet, the family of the mamma. Now, 8 years, but you are necessary, minister. Cocoa, $1 na cocoa. You have seen this cocoa. Now, Afidiano, a bank of $2 billion. $2 billion. I see the top of dollars. Of $2 later, dollar no $1. Can you not put yourself to money? $4 in the money. Let me see this amount.
Away from election, let's do some more stories on your election poll center. The Ghana Immigration Service yesterday commenced a 3-day regional technical conference on strengthening regional partnership for effective border management. The event was organized in collaboration with the International Center for Migration Policy Development, which is founded by the European Union Emergency Trust Fund for Africa. This event aims to enhance Ghana's border security by building capacity and improving regional cooperation, and also serve as a platform for regional stakeholders to discuss and plan future border security initiatives. Derek Kumikisiedu has more in this report.
Ghana, with its extensive land border shared with Burkina Faso, Cote d'Ivoire, and Togo, as well as a significant marine boundary along the Gulf of Guinea, faces numerous border security challenges. These include human trafficking, smuggling of goods, drugs, arms, and the threat of terrorism and organized crime. The Ghana Immigration Service yesterday commenced a 3-day regional technical conference on strengthening regional partnership for effective border management, organized in collaboration with the International Center for Migration Policy Development, ICMPD, which is founded by the European Union Emergency Trust Fund for Africa. Speaking at the opening ceremony of the 3-day event, the Controller General of the Ghana Immigration Service, Mr. Kwame Uwatechi Esquire, praised the European Union for its financial support and remaining steadfast in its quest to ensure that the Ghana Immigration Service is resourced.
The service has received other numerous donations geared towards effective migration management under this policy. I recall that during the heat of the COVID-19 pandemic, the FPS Ghana project donated 3 Toyota Hilux pickups and 2 Toyota urban buses, as well as PPEs, and offered training on infection prevention control to support of contact tracing. Ladies and gentlemen, I must say that through all these years, the European Union has remained steadfast in its quest to ensure that the Ghana Immigration Service is resourced to an extent to execute its mandate. And I am most grateful for the financial support that we have enjoyed over the period under this period.
The West African Region for International Center for Migration Policy Development, ICMPD, Dr. Mojisola Sudindi, in an exclusive interview with ABC News Ghana, tells us how they got in contact with the Ghana Immigration Service to collaborate on a 4-year strategic plan in which they identify some needs of the Ghana Immigration Service.
Yes, ICMPD and Ghana Immigration Service has been working together for quite some time now. I would say about 8 to 7 years. And it all started with a project called the Support to Free Movement of Persons and Migration, funded by the EU. And as part of that project, we worked with Ghana Immigration Service to develop a 4-year strategic plan. Through that 4-year strategic plan, we were able to identify some of the needs that Ghana Immigration Service had. And based on that, the European Union approached ICMPD to help to support GIS.
The workshop aims to create a collaborative environment where participants can share experiences, learn from each other, and develop.
That's all.